specialize in child psychiatry?
My life made a few different turns that I did not avoid.
A memorable case that significantly impacted your approach to treatment.
Certainly.
Does Chicago Child Psychiatry Associates contribute to the local community?
In the past, we did multiple presentations at various for over 7 years now to be listed as one of 3 best rated psychiatrists. Thank you.
What inspired you to specialize in child psychiatry?
My life made a few different turns that I could not avoid. I was a resident in a vascular surgery back home in Bosnia during the war. After that, I became a refugee, came to the United States, where I was lucky to start working as a mental health counselor with traumatized refugees from Bosnia and Herzegovina who experienced genocide, ethnic cleansing, survived concentration camps. Doing that work did get my attention to the talent that I had or have, which is talking to people. At that time, I learned that working with children and adolescents is the most rewarding, and I still enjoy that the most.
How has Child Psychiatry Associates evolved since its inception?
So the Chicago Child Psychiatry Associates was an idea I had from the beginning. Although I started it with a partner, he did not step in with the same force as I did. After doing it just by myself for many years, I have decided that it's time to bring other professionals into the practice.
Can you share a memorable case that significantly impacted your approach to treatment?
Certainly. Years ago, I treated a girl at Rush University Medical Center at the Fort Kellogg Inpatient Child Psychiatry Unit. This is really the case that I'm going to remember all my life. I was her inpatient child psychiatry attending. This girl has tried to stop her life many times by suicide attempts and had back-to-back multiple inpatient hospitalizations that failed in the past. At the discharge from the hospital, no clinician was comfortable accepting her as an outpatient patient due to concern that she may complete suicide. Her family was desperately asking me to take her as my private patient, and I could not refuse despite the risk. I treated this girl for about 5-6 years, doing therapy and medication management. Her family was highly involved in the treatment. Since then, she has excelled in her life, became a great student, graduated from treatment with me, moved to a great college, and was invited to the inauguration of one of our former presidents as one of the best students at her school.
What challenges do you face in providing mental health care to children and adolescents in Chicago?
I think the main challenge is explaining to the patient and family that our work is not a quick fix, that we need to be patient before seeing results, that we have to move forward in small steps.
How do you ensure that your patients receive personalized care?
The first visit or 2 is the key of our evaluation process, where you spend significant amount of time gathering essential information and data. That brings us to the position where we can say what is the best course of action for a patient. The key is to give the space and make the patient choose what they are comfortable with, understanding that we are not forcing anything on them.
What advice would you give to parents seeking mental health support for their children?
Well, these days it is very important to research and understand what the different types of mental health professionals are available to work with your child. Some are mispresenting, some are calling themselves with professional names that are not validated with credentials. Professionals trained to work with children and adolescents should be checked and clarified so that one knows who will be treating their loved one.
What are some common misconceptions about child psychiatry that you encounter?
Probably the most common misconception is that we can help and treat our patients in a short time frame. Some families do expect us to practice as internists or pediatrician, issuing refills and not having close, frequent contacts with the patients. That is really not possible in our field. We really need to know our patients and their problems very well, which can only be done if we repetitively see the patient. We do not have x-rays, we don't have CT scans, we don't have MRIs, not even much of the blood tests that help us to get the diagnosis. We only have our knowledge, experience, and ability to see and recognize the issues, which is something that requires time and frequent multiple visits.
How does Chicago Child Psychiatry Associates contribute to the local community?
In the past, we did multiple presentations at various organizations involved in work with children, trying to provide information, educate, and explain what we can do. I also worked as an inpatient attending at the hospitals, providing services to the community. Since COVID, while getting really busy, we are getting less engaged in such activities. However, recently, we started collaborating with Mosaic, a psychotherapy practice that is active, very active in western suburbs of Chicago. This organization is very engaged within the community, and we hope that we can contribute and increase the level of engagement.
What do you think about current trends in mental health?
I think that currently mental health is going in an upward direction. The main reason for that is the epidemic of mental health issues during COVID and the video or tele-availability. Telehealth availability is making us available to patients in remote parts of states where we practice.
Can you give a critical opinion about current healthcare trends?
Certainly. I made this far in my practice with one major idea. It is the patient is first, everything else is second, including the financial part. My concern is that we are losing the sense of what are the priorities in US healthcare, and that financial components at times become higher priority than an individual, personal, human approach to the patient.
How does it feel to be listed on 3 Best Rated and called the best in the business?
It has been a privilege for over 7 years now to be listed as one of 3 best rated psychiatrists in the Chicago area. At the first, it was a great surprise. Later, I just tried to keep up with the challenge, good work, and stay in the game. What I like about 3 Best Rated is that your organization does not operate like others doing this type of promotion for upfront money. 3 Best Rated does not request money or to pay for this privilege. Your appraisal or evaluation of the business is genuine, honest, based on patient feedback and reviews, which is very helpful to consumers. It is also meaningful reward to those who are trying to do good work for their clients and patients.
Thank you.
Thank you.